Hello, my name is Dr. J. Michael Bennett. I'm an orthopedic sports medicine physician practicing in the Sugar Land, Katy, and Houston areas. I specialize in minimally invasive and open surgical procedures involving the shoulder, elbow, and knee. Today we're going to go over a topic that is often asked in our offices, and we often see this online regarding bracing and regarding knee injuries. So we're just going to go over a couple of braces that we have here and that you're going to run across in your local CVS's or your Targets. First off, a very popular brace that you'll find a lot of people wearing, particularly when they come into clinic, is this neoprene brace here. It's basically a circumferential brace. There's no holes. Sometimes you can find a variation of this brace with a little hole in the middle where your kneecap goes. These braces are not necessarily braces. All they really are is a sleeve. If you have any mechanical issue with your knee, such as a ligament issue or your knee's unstable, these are not going to help you because the ligament issue is a mechanical issue. These are good primarily for swelling. If you have any puffiness in your knee, a little arthritis in your knee, you may want to purchase one of these and just use them if you notice any swelling going on in the knee, in addition to doing some ice therapy and maybe taking an anti-inflammatory if it's recommended by your physician. But be warned, the more you wear these braces, the weaker your quadriceps are going to get because the more your body depends on the brace to stabilize your knee. So these are very good temporarily if you're having swelling. If you want to decrease your swelling, you can use these if you're playing a sport, but I would not rely on these and use them on a daily basis. If you're having to use this on a daily basis or you have instability of your knee, please see an orthopedic surgeon immediately and get an evaluation. The next type of brace, this is called a lateral stabilizer brace. This is a little bit different. It slides up on the knee like the last brace, unstraps here and here, and this is actually also called a J brace. Okay, you slide this up, the kneecap goes in the middle here. The reason it's called a J brace is because this provides a buttress of support here. This is primarily for patients that have patellar instability. If your kneecap is popping out of joint or it's riding up on the outside of the knee, this J support helps hold it in position. Now all that these straps do on top is reinforce it. So they wrap over and they basically vice grip that patella, that kneecap, in position so it doesn't pop out of joint or maltrack. Now, once again, if you're having multiple instabilities of the kneecap and you have not been evaluated by an orthopedic surgeon or a sports medicine specialist, I do advise you to get evaluated, because if you do have multiple dislocations, you could be getting injury to the ligaments in the knee, or you could be injuring the cartilage underneath the kneecap and knocking off any small flaps or flecks of cartilage in the kneecap, which would increase your risk of arthritis and also increase your risk of recurrent dislocation. It just will not get better. So, like before, you can find these over the counter and they may be able to help you temporarily, but if you have recurrent issues regarding kneecap stability, please see an orthopedic specialist or a sports medicine specialist. The last brace here, this is called a Roadrunner brace, also known as a double hinged brace. The difference between this brace and all the other braces are soft braces. This brace actually has a hinge with a metal bar on either side. This brace allows you to bend your knee. So you basically slide this brace on, and it's got multiple straps that wrap around the brace to fit it to your knee. Now this brace is better for ligament injuries, particular ligaments, the medial collateral ligament and lateral collateral ligament, which is the ligament on the inside and the outside of the knee. This is not necessarily as good for an anterior cruciate ligament injury due to the fact that this does not help prevent rotation. It may help varus or valgus, which is bow-leggedness or knock-kneed instability, but it's not going to help you with rotational instability. But if you have to have something to give you some support until you see an orthopedic or sports medicine specialist, this is probably the best kind of brace you're going to be able to get over the counter. Until you see your specialist and they want to give you some sort of custom anterior cruciate ligament brace or a custom brace used for posterior cruciate ligament injuries. But this is good for an MCL sprain or LCL sprain or even just a ligament sprain in the knee. Well, as I mentioned before, it's not going to control for rotational instability. That's very hard to control for, even in a custom brace. So if you do have rotational instability, meaning instability or looseness in the knee when you twist or turn, then please get evaluated by an orthopedic specialist or a sports medicine specialist, because you may have a cruciate ligament injury and it needs to be diagnosed. These, if you leave these alone, you're going to cause further damage to your cartilage, such as your meniscus, or even the articular cartilage, which is the lining of the joint, and you're significantly increase your risk of arthritis and problems down the road. So, as usual, please go to my website, jmichaelbennett.com, orthopedicsportsdoctor.com for more information. If you do have any questions or would like a consultation, please call our office at 281-633-8600, and thank you very much.